Hello everybody, my name is John Newton and it's my pleasure to talk to you about the UFA Public Health Week theme of All for One Health. I'm the Vice President of the UK Faculty of Public Health, but I'm also the Director of Health Improvement in Public Health England, and I'm Professor of Public Health in the University of Exeter, based at the European Centre for Environment and Human Health. This theme, All for One Health, is an incredibly important one for us now, but also for the future of public health, increasingly so. It's the realisation that human health is inextricably linked to the health of our planet and to all other life on the planet, both animals and plants. We all share the same ecosystem, and if we want to enjoy health as individuals or as societies, we need to ensure the health of the whole ecosystem, and we are incredibly dependent on that. And there are many causes for concern. Increasingly strong scientific evidence, a political and public understanding that the climate crisis is one of the biggest crises that we've ever had to face in human history. Climate change itself is a direct threat to health, and it's becoming clear that the climate will affect quality of the air, quality of water, and quality of food, and in availability and security of food, as well as our access to shelter. So what is there to do? Well, in public health, of course, we are very well placed to have an impact. We need to recognise that the requirement for public health action is changing in response to this greater understanding of the importance of One Health and planetary health. Much wider groups of professionals need to work together to address these new problems. That's scientists and policymakers, but also those involved in implementation. And many of those groups are well beyond the traditional health sector. Governments and professionals, of course, have a big role, but so also do consumers and industries, particularly commercial industries who drive consumer purchasing power. And if we are to tackle the impacts of climate change and One Health more generally, we have to work in a much more broad way than we have perhaps traditionally done in public health in the health sector. I mentioned food earlier, and food, of course, is incredibly important for health, and we are currently trying to address the problems of obesity in many countries in Europe. But ensuring a sustainable food supply is equally important, and indeed food security for people who are in vulnerable groups. Health systems themselves need to change. They are very large organisations, and they have an impact themselves directly. So we need to encourage health systems to embrace sustainable approaches. They need to adopt prevention, they need to operate to promote equity, but also to minimise impacts on environment and to promote healthy environments at the same time. Now, of course, health systems across Europe are currently responding to the enormous shock of the pandemic. And many governments and providers of healthcare are now thinking about the recovery from the pandemic, or looking forward to the recovery from the pandemic. And it's essential that that recovery is both equitable and sustainable. So in many ways, this is a great opportunity to try and emphasise the principles of All for One Health as we emerge from the terrible consequences of the coronavirus pandemic, but with a new realisation that health, equity, sustainability, and resilience are incredibly important for the future. Now, the UK Faculty of Public Health has recognised the importance of climate change. We've set up a new committee and we've declared a climate emergency, and we're looking forward to publicising and promoting and having an impact as we approach the COP26 summit, which will be held in Glasgow later this year. And in terms of policy, it's essential that those of us in public health promote the UN Sustainable Development Goals, the Paris Agreement, and the EU Green Deal as fundamental policy principles for public health and for those areas related to public health that we might be working in. And I think I would leave you with the thought that we all need to reflect on how this new understanding of the importance of planetary health, how we can incorporate that into our own practice, what the implications are for us personally, for us in our professional roles, and how we can help others respond to this change in our understanding of what really matters if we are to achieve public health objectives. Thank you very much.